So what specifically was Tearfund doing? Well, we ended up working through into what I call a three-phase response. So phase one was we mapped out our own business continuity. One of the critical issues we needed to work out was who could move where, what partner was capable of doing what, where could we operate safely, and providing that duty of care and safety to those that we were in partnership with as well. But at the same time, we recognised from our learning from Ebola that resources, information needed to get out there quickly, fast, and globally. So we knew from our experiences in Ebola that communities needed to trust their sources of information. Maybe they had a broken relationship with the government. Maybe they didn't want to be trusting information that was coming out over the radio. A lot of the time, the critical source of their information was a trusted faith leader. And we knew then that places, the village like Magdala, we knew that we were able to then get correct and appropriate information to them in a community discussion setting, and they now know differently in Magdala. But we developed these online resources, and if you're interested for yourself, you can go to Tearfund Learn, and we were absolutely blown away by how much they were downloaded. Within the first 6 weeks, we had 10,000 downloads of all of our resources. People were desperate to have trusted sources of good and effective information about how they could do water and sanitation programs, what was the theology behind COVID, etc., etc. And we realized that there was just such a desperate need for that information, and we could fill that gap, and we willingly did so. The second phase we moved into was with the money we began to gather in. We went to do emergency projects, particularly on public health education and water and sanitation issues. So we gave out radio messaging to hundreds of thousands of people in different parts of the world. We established safe water, access to safe water so people can wash their hands. We spoke often in the UK about PPE and access to PPE. As a health colleague said to me, I'm not so worried about PPE, I'm worried about water and soap. Then we moved into our third phase, the longer term, to address the secondary economic and social impacts. And to be frank, this is where the need is absolutely the greatest. We know that there have been people badly affected by COVID, but they are of a smaller number than those who've been affected by the economic impacts. And at times like this, there is an escalation of violence between communities, with domestic violence in households, child marriages, forced labour, and we need to provide projects that provide that social protection. We also need to provide livelihoods and more kind of like support to provide projects to re-establish livelihoods. But this has been set against a backdrop of cuts. We've had to make 15% budget cuts for us as an organisation, recognising that we have begin to see donors, international donors, make different decisions. Is against a backdrop of international restrictions on movements, and it's based against a backdrop of lack of access to flights and increasing cost of flights. But I'm fortunate to work with hugely innovative and creative counterparts, and we have all come together as an organisation to still ensure we prioritise quality, and as much as possible we prioritise the effective outworking of our projects and programmes.